Just about ready. I'll wait till it officially turns 1:15 here. And it has. So we'll go ahead and get started. Welcome, everybody, to our news briefing on all things regarding COVID-19 with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. We welcome your questions after some opening statements. We are going to do the order a little bit differently this week. We're going to start off with Brian Shockney at IU Health.
Thank you, Chuck. Good afternoon, everyone, and I hope you all had a nice holiday and a good new year. Our most recent numbers are continuing to show a high volume of COVID-19 patients in the South Central region. The same is true when we combine the numbers of both IU Health Bloomington and Monroe Hospital. Across the IU Health system, we have reached a record high of COVID-19 patients with over 600 patients in our hospitals today. Our regional COVID inpatient graphic shows that unvaccinated people continue to make up the majority of individuals who need hospitalization when they have COVID-19. Others on this meeting are going to talk about testing. However, if you're seeking COVID-19 testing, we'd ask that you please not seek testing at our emergency departments unless you're truly experiencing life-threatening illness or injury. Emergency department physicians throughout IU Health and the state are caring for a large number of patients, including those with urgent COVID-19 and other serious ailments, as well as trauma, cuts, and broken bones. To preserve our staffing resources and reduce your exposure to the illness, families with patients experiencing mild symptoms can contact their primary care provider, go to one of our urgent care clinics, one of our walk-in clinics, or a community site to receive a COVID-19 test. Locations for testing can be found by visiting the Indiana Department of Health and Monroe County Health Department websites. You can also find a list of Monroe County specific sites on our Facebook page, and we'll include those in the chat, that link in the chat. So I'd like to take a minute to talk about a recent IU Health campaign we've been sharing locally in the news and on social media. On your screen, you see there's just some of the images we're using to show the impact this pandemic and most recent surge is having on our hospitals and teams. Our hospitals are at our highest capacity we've seen, and we have patients waiting to get into a patient room every day. We're also struggling to get patients transferred to hospitals outside of our region as hospitals across the state of Indiana are on diversion or cannot accept additional patients. Regional leaders are in daily meetings where we discuss our local bed capacity and resource needs, as well as how we can help team members. And almost every day for the past few weeks, we've had to expand our bed capacity. This expansion is at the expense of patients who need surgery and outpatient care, as we utilize our outpatient and surgical spaces and those staff members to care for these patients. Our teams are tired, and just like the first year of this pandemic, the stress and strain is causing compassionate, skilled, and caring healthcare team members to consider leaving their life's work. In addition, our National Guard members have completed their invaluable support to our South Central Region hospitals as they must transition to other locations. There are some easy ways for you to help, and here they are. Get vaccinated, get boosted, get tested if you feel sick or have been in contact with a COVID positive person. Wear masks in public or when around people you don't live with, and physically distance from others. As you can also see, we are not on a good path in Indiana related to the spread of the virus and hospitalizations. You can see IU Health is caring for its highest number of patients pandemic to date. 70% of these patients are unvaccinated. We are also experiencing team members being out due to COVID symptoms and positivity that puts further strain on our ability to respond to this pandemic. Yes, we have hope, and we know that this pandemic will someday become endemic to our society as the seasonal flu has become. However, right now, at this point in time, we are asking each of you to do all you can to stop the spread of this virus for the next few weeks. And how you can make the biggest difference is through the selfless act of ensuring you do not contract or spread the virus. And this will have a multiplying effect on the lives of our community and our healthcare heroes. I'm happy to take questions at the end, and thank you as always for those who are vaccinated and doing all they can to protect our community.
All right. Thank you very much, Brian. We'll next go to the Monroe County Health Department, Penny Caudill. And for the purposes of your questions, I know Penny has to dip out at about 20 till 2, if I understand right. Penny, go ahead.
Right. Thank you. This week, our cases rose to 468 per 100,000 residents, and our positivity rate is over 10%. These numbers moved our county advisory level to a 2.5, which is still orange. Although if you did those calculations right now today, we would be red. Currently, 60% of those eligible for vaccine have had at least one dose of the vaccination, and almost 59% are fully vaccinated. But we have a ways to go. If you need your vaccination, whether you need to start the series or you need your booster, you can visit ourshot.in.gov for a list of all the vaccine sites. This week, the FDA expanded the use of Pfizer COVID-19 vaccine. The ACIP and CDC have approved these changes. So Pfizer COVID-19 vaccine can now, they've shortened the time between the completion of your primary vaccination of Pfizer vaccine to 5 months, down from 6. And it allows for a third primary series dose for certain immunocompromised children ages 5 to 11. It also expanded the use of a single booster dose to include those individuals 12 to 15 years of age. In terms of testing, with the extremely high demand for testing, the numbers of people who are infected right now and symptomatic seeking testing, supplies are not meeting the demand. And we've been here before. I'm not sure that we've been in this exact place, but we have had demand higher than supplies before. In response to that, the Indiana Department of Health changed some procedures this past week, and rapid tests at state-supplied testing sites will only be available to individuals aged 18 and younger, and those symptomatic individuals who are 50 and over. A mobile site is currently at 800 North Indiana Avenue, and it will be there through tomorrow, noon to 8 p.m. It's open to the community, and I want to thank again Indiana University for providing that site and the logistics for making that come to fruition. Testing and vaccine is available, and Kirk may share more information about that. You can find appointments through the state map that was mentioned earlier. We will request these mobile units ongoing as long as the demand and the need remains high. The Indiana Department of Health Gravity site also is available on the west side of town. It only does PCR testing at the moment. They are open Tuesday through Saturday, 8 to 4 p.m. No appointments are needed at this location. Now, we have had some reports and some good feedback on some changes that they have made just this week. They have a new system using an ID-ME QR code to make registration simpler. They've added additional signs and other things to make the process move. And we've been told that the wait has been dramatically reduced with those changes. But again, the demand is high at all the testing sites. There are waits to get those tests. Another change that has been made that I think will make finding information out about that site a little easier. You go to that state testing map, the Gravity site now appears as Monroe County, Curry Pike, and then it will show you that that's the Gravity site. Before it said Cook property, and it was just very confusing to people. So we hope that this will make it easier for people to locate that site. If you are sick and you cannot locate a testing facility or a home test, then please stay at home. Isolate until your symptoms improve, your fever is gone for 24 hours, and at least 5 days have passed since your symptoms started. A mask should be worn when you're around others, indoors or out, for an additional 5 days. You can't do that, remain in isolation for the full 10 days. It is better to act as if you are positive than to risk sharing this infection with others. The CDC also recently changed isolation and quarantine guidelines based on data around when someone is most infectious and likely to transmit the virus to someone else. It also supports the effectiveness of good, properly fitting masks. Quarantine, close contact, follow-up also changed, and more changes will likely come. As for school and workplaces, we are working with schools now, and they are assessing their situations and what changes they will or won't make. But while this CDC guidance now allows for a shorter isolation and quarantine option, it does not mean that you have to immediately follow these lesser restrictions. You may continue to be more restrictive. Further guidance is continuing to come out, and many schools and workplaces may want to see what this guidance is before they make additional changes. Being prudent and waiting for these updates is absolutely fine. Breakthrough cases, infections in people who are fully vaccinated are just over 3%, but those who need hospital care, those breakthrough cases who need hospital care, or where we see deaths are under 1%. So vaccine does work. My message for this week, again, is that this ride is bumpy. We will get through it, but it is very clear that it will take all of us working together to stop this surge. So please do your part, vaccinate, get your booster when you're able, protect others as well as yourself, mask up, wash your hands, use isolation and quarantine guidelines so you don't pass the infection on to others. And if you operate a business of any kind, take a moment to pause and assess what you might do better in the next few weeks to help us end this surge. We've learned a lot over the past 2 years, including how to adapt and pivot. I've been amazed at how creative and adaptable people have been. We still have a mask regulation in this county. So ask yourself, can you improve your signage about that? Can you provide masks better? Can you step up expectations and letting people know that you expect them to wear that mask and follow that regulation? Can you remove 1 or 2 tables in your facility or rearrange them to provide more space? And while we can't require proof of vaccination to enter a business, some businesses have found that that requirement has been helpful to them. So consider, is that something that could work for your operation? Look at what you can do to protect your staff and your patrons, whatever that may be. Thanks, Chuck.
Okay, let's next go to the Monroe County Commissioners. Today, it'll be Penny Gibbons.
Thank you. We've heard some very sobering numbers so far today, but I wanted to share what I hope is something a little bit more upbeat. Yesterday and Wednesday, the Monroe County Commissioners sponsored another blood drive. There was a goal of collecting 120 units, and they were able to collect a total of 122 units of blood to help with the extreme shortage that we're seeing regionally. I want to let people know that we have other blood drives scheduled, one for January 31st from 10 a.m. to 3 p.m. and on February 2nd from 1 p.m. to 6 p.m. Both of those will be out at IB Tech. You can register through the Red Cross website at redcross.org. I saw very sobering though statistics just earlier today that less than 4% of our population are responsible for donating the blood that's critical to helping those who are in need. So I urge anybody who's able to get out and do it. If you've never done it, it is not as painful as it is, some people might imagine. And so please, that's January 31st and February 2nd for those blood drives. We continue to make money available through the county, through the township trustees for those who are in need of assistance with rent, mortgage, utilities. Every single resident of Monroe County, whether you live within Bloomington, Steinsville, Ellettsville, or in the unincorporated areas, has a trustee. So if you are in need, please go there, especially in these cold, cold times. We don't want more people to be unhoused. You can sign up for resident alerts at the Monroe County website, which is co.monroe.in.us. And that may become important as we get new regulations out and new information out about COVID. So if you go to the website, click on the megaphone, you can sign up. And finally, perhaps most importantly, the county's COVID vaccine requirement goes into effect. This is for employees on Monday, January the 10th. We're doing this to be in compliance with the OSHA regulations, and this will require people to either show evidence of being vaccinated, or they will have to have weekly COVID testing. And because of the county mask mandate, we still are asking all employees, regardless of their vaccine status, to wear a mask when they are indoors, and especially when they are around others. That's all I have today, but again, I hope people will sign up for those blood drives.
Okay, let's next go to Mayor John Hamilton.
Thanks a lot. We're having this unscheduled press conference. We weren't on for this week because of the really dire news that we've heard. It is a hard way to start a new year, but hearing from Mr. Shockney and Administrator Caudill in particular, and the news of the dramatic increases and challenges is why we wanted to have this press conference. The city, I'll just report our quick numbers. We have 14 cases among our employees this week. That's a high number, continuing the pattern of the last several weeks. 69% of our active regular employees have demonstrated they are fully vaccinated, 69%. That's been pretty steady. I will report the utility numbers. The new numbers are quite significant. The Dillman report, which is the larger part of the city, has had a 10-fold increase in the detection of the virus in the waste stream, up to 1,600 copies per 100 milliliters. And the Blucher pool on the north side is at 290. That's up from 210. But that's a 10-fold increase in the Dillman number is pretty significant. I also will just report, because of staff pressures and shortages, we will be having to close the Banneker Center for 10 days over the next 10 days, today through the 17th, with employee shortages. Just reflecting, I know businesses are dealing with this all the time. City government does all we can to keep everything open, but that's one announcement I'll add too. So we have to flatten the curve. It's extraordinarily challenging these next few weeks. It's imperative how we all behave over the next few weeks. Of course, in the long term, it's vaccinations and boosters. We will do everything we can to encourage folks to do that. In the short term, in the next few weeks, also, it is so important to use masks, N95s, KN95s where possible, and just don't share air if you don't have to. Particularly, just don't share air with people outside your home if you don't have to, and use the masks indoors to avoid that risk. We are, as Commissioner Githens mentioned, the city has put its program in place starting this week to require employees to demonstrate either vaccination or a negative test weekly in order to work. We're going to continue to work on that for our employee safety. We see the numbers of a spread in our employees, protecting our essential workforce. We know how important it is to keep public safety, safe water supplies, sanitation, passable streets, et cetera. So we are very focused on making sure we're doing all we can to keep all our employees safe. Signs were mentioned. I appreciated that. There are new signs that have gone up in a couple of our indoor facilities like Twin Lakes and the Frank Southern Ice Center that say, wear a mask and be kind to employees. I know so many of us who experience frontline workers who get stressful situations because of the mask requirement. We feel that too in city facilities. We're continuing to try to indicate if you can't wear a mask and be courteous to each other and employees, you won't use the facility. And I do think it's a good exhortation to other institutions locally, businesses, proprietors, managers of facilities, to consider taking steps to make sure we keep our frontline employees safe and dealt with courteously, and also to implement the mask requirement. Over these next few weeks, flattening that curve is critical. Our health system saves our lives, but they need our help now to flatten the curve in order to keep doing their jobs. We will do that by not sharing air with others and getting those vaccinations. These short-term inconveniences are really important to save lives and bring that long-term benefit. So wear a mask, be kind to staff, get your vaccinations and boosters, and happy to take questions at the end.
Okay, this next check-in with Indiana University. First Aaron Carroll and then Kirk White.
I don't want to reiterate what everybody else has said, although it can't, we should be screaming it as loud as possible. We all recognize that things are, hot at the moment. The single best thing we can always do is vaccinate and booster. We have not achieved that in Indiana. We're ranking among the lowest states overall in vaccination rates. And it would be the best thing we could absolutely do is get that up. I know everyone is working towards that, but it's hard. And I have plenty of colleagues and friends who are healthcare providers, and they are absolutely stressed. And it's going to be a rough few weeks as we inevitably watch the surge continue, and hope that we flatten it and that we peak and start to come down as soon as possible. At IU, we are gearing up for students to arrive and classes to resume next week. We are vaccinating and boosting as hard as we can. We are going to be incentivizing students to get boosted. We are holding many, many booster clinics, including this week and next week and beyond. We are significantly ramping up our ability to do symptomatic testing, including drop-off testing, so that we make sure that we can do everything we need to do to keep students safe. We're preparing Q&I facilities, should we need them, to house congregate living students who may become infected. And we're doing everything else that we can, just as the rest of Indiana is, to keep everyone as safe as possible. We will, of course, continue to mask in all of our public settings, including classrooms. We've asked everyone, including professors, in the month of January, not even to remove their masks to lecture, that they should be masked up at all times when around each other. Of course, the better mask is better. We provide surgical masks in pretty much all of our buildings. But of course, if people want to wear KN95 or N95, we fully endorse that as well. Everybody wearing the best mask that they can all the time is the best thing that we can do. And then plenty of communications, of course. Keep everybody informed as to how things are doing, especially when recommendations keep shifting at a national level right before our eyes. But we will keep pushing for all the measures that have existed in the past, doubling and tripling down on them as necessary, in order to make it safer to be part of the IU community and therefore part of Bloomington than not to be. And while I expect that the next few weeks will be rough, given a look at any projections that exist, we're going to do everything that we can to weather it the best we can, and then continue to work towards safety as hard as we can.
Thank you, Dr. Carroll. Just to provide some Bloomington Campus specific information, our COVID testing for this past week has seen 260 positive cases. That's up from 118 cases in the last week of the semester in December. So that really doubles the rate here this past week. 179 of those positives were students and 81 were faculty and staff. As Dr. Carroll mentioned, we'll be back with in-person classes starting Monday, but we're really trusting our high vaccination rates, our mitigation testing that we're continuing, and our indoor masking procedures to give us the best shot at having a successful kickoff to the semester. And I would just say that though you hear a lot about a few colleges and universities who have delayed things, really Indiana University is among 90% of the colleges and universities in the country that have decided to go ahead and start on time. And this is really because of the experience that we've had in managing the pandemic up to this point, different procedures that we have in place, and really high vaccination rates. Unlike most other populations, university campuses like ours that have a vaccine requirement have a high vaccination rate, which really means that your chances of getting seriously ill are much less. Though with all of that, as Dr. Carroll mentioned, we're reviewing our contingency plans to make sure that we provide additional symptomatic testing, that our quarantine and isolation housing is ready to go to full speed if need be. And we'll continue to monitor all this on a daily basis and and make changes as need be. Really, this is going to be a team effort. We need to be thinking about being nimble and flexible at this time with all kinds of different activities that are going on in the campus. So we may need to make changes, but that's the way we'll get through this and be able to keep going. Really, vaccinations and boosters, as we've talked about, is the key to surviving this next surge. And as Administrator Caudill mentioned earlier, IU's been hosting a special state mobile clinic at 800 North Indiana Street since Wednesday. We've had tremendous success out there, hundreds of people coming each day. That'll continue till 8 o'clock tonight and again tomorrow from 12 noon to 8. We encourage you to make an appointment to get scheduled at the state site, which of course is at coronavirus at Indiana, the coronavirus Department of Health site, ourshot.in.gov. And this will continue, as I said, through tomorrow at 8 o'clock. So 8 p.m. We encourage you to sign up and or show up, either one. Let's get vaxxed. Thank you.
Okay, happy to take questions. Not one in the chat at the moment, so I will vamp for a moment as I give you a moment to ask the question. So we on cue, George Hale with a question for Penny, but it'll go to Kathy, who will be answering, Kathy Hewitt in Penny's stead. Is Flurona a serious concern? Or Flurona, I guess would be the proper pronunciation. Flurona would be a band from the 1970s, I think. Flurona.
Hi, they are starting to see some cases of that. And yes, that is a concern that people may end up getting both of those. So they are watching for that at the state. So.
Aaron, following up on that, is that we have always pushed flu vaccines on the IU campuses. How much more important is that now?
Yeah, well, maybe I'll be contrarian here. I can't stand that word. And the idea that we are labeling a new syndrome because people got two communicable diseases at the same time is strange. I mean, I'm a pediatrician. Kids get RSV and flu at the same time all the time. I mean, it's statistics. If you have an X percent chance of getting one and X percent chance of getting another, multiply them together, and that's the percent chance you might get both at the same time. It happens. We have no real evidence that this is any more likely or anything. We just had no flu last year because we were all locked down. So look, we don't want people to get communicable diseases. We don't want them to get coronavirus. We don't want them to get flu. But some small percent will get both just by chance alone. And the way we avoid that is, of course, the way we avoid each of them. Vaccinating against COVID and vaccinating against flu is the best way to avoid making sure that you get neither disease. But I would hate to see huge resources devoted towards worrying about these two things together when it's going to happen. And I'm not sure that it is much more concerning or anything people should worry about more than the fact that they both exist and that having two is clearly worse than having one is clearly worse than having none.
Question from Dave Askins for Commissioner Givens. Do you have any updated figures you can share on the number of county employees who have been vaccinated and any anecdotal evidence that you can offer about employees who are actually persuaded by the $1,000 incentive?
Sorry, I don't have completely up-to-date information at this point. Part of it is that the requirement is that they have to, show us by next Monday. But at this point, it looks like that we have at least 75%, maybe 70% of our employees who are vaccinated. We'll know more soon, because at this point also the elected officials, because of how salaries are paid within the county, the elected official numbers will be added into those next week. So I'm sorry I can't be more precise, but hopefully that number will rise even more. And once we have numbers, we'll be happy to share them. I don't have any anecdotal numbers, information about people that have been persuaded. I think that having to go get tested every week may be more of a persuasion than the $1,000 that we've given to each employee to incentivize them getting the vax.
A question from Dave for Mayor Hamilton. According to the city's OSHA compliance policy, the city may choose to provide and/or sell self-administered tests to employees. And the question is, what will Bloomington's approach be, provide or sell?
Well, at the moment, we are trying to procure tests, and as everybody knows, that's not a simple matter. At the moment, we have instituted the requirement that employees get those tests. We are working whether we'll be able to provide them directly in the workplace. We're looking at that. Whether we will sell those in the workplace or provide them is a matter still to be determined. But at the moment, we are not directly providing those tests. We don't have a big number on hand, but we are trying to arrange for that for the future.
Another question from Boris Ladwick from the Herald Times. This one for Brian. How many National Guard staff are at IU Health Bloomington Hospital, and how many of those are doctors? How many nurses? When exactly are they leaving? And how important was their deployment locally to relieving exhausted local staff?
Good question. We had 12 in the region that we were getting support from. The majority of those were support staff who did very important jobs, such as continuing to support supplies and our stocking of our protective equipment. We did have a couple medical techs that were able to help us at the bedside. No nurses or doctors were in our region supporting, but a lot of the support for stocking and sitting with patients and support staff of that nature, they were critically important. Actually, we've put a call out to our administrative staff, including myself and others, to fill those positions that they've been filling, as this was their last week of being here in the South Central region. And so we're having to fill those positions as administrative team members to be able to continue the great work that they were doing to keep us going forward with stocking supplies, supporting patients, and also screening patients in all of our facilities as well.
Another one for you, Brian, from Boris. How many additional hospital beds, including ICU beds, has IU Health Bloomington created in the last few weeks? How many more can you create given staff limitations?
I'll say we are blessed to have this new hospital because we moved to an acuity adaptable model, which means we can expand our volume of any type of bed throughout our facility. So we've been able to expand our ICU beds to the number that we need. So that flexes hour by hour and day by day. We continue to care for patients who come to us. We've been moving to what we call team nursing, where we have expert nurses who can then lead a team of other caregivers to help care for a pod of patients, which is a different methodology than we normally use, but it's a very safe methodology that has been proven, and we've moved to that type of nursing and care with a team of individuals rather than that one-on-one nursing care that you would and expect to get in a setting when we weren't in this pandemic and have overburdened with patients.
Sticking with you, Brian, how often does it happen per day that you have to turn away people with critical care needs, such as those who have been injured in motor vehicle accidents? And how many procedures have been delayed so far? And what are the implications of that for the patients as well as hospital staff once the latest COVID surge subsides?
So we never turn anyone away. I'd had this question asked of me previous in the week. And, if you're in a motor vehicle accident, or you have a heart attack, or you're serious, we take you and we care for you, and our resources go to that location. The concern is that then those resources have to move away from another place within the facility. And so we have to continue to move those resources throughout our facilities on a minute-by-minute basis, which makes it very difficult for us to, provide care in the way that we want to provide it. We never turn anyone away from coming in for, a vehicle accident or trauma or something. Hundreds of people We are now scheduling some people rescheduling some people for the third time for their surgeries through this pandemic. We have a triage system that we look at. We work with our physicians, our nurses, and our medical directors, and we evaluate the symptoms of emergent, urgent, and less urgent. And we have a numbering system. We look at those patients, and then we schedule them accordingly. So we have hundreds of patients who need surgery, who are in pain, who have conditions that require surgery, and we cannot do them. We also have facilities, brand new facilities here at IU Health Bloomington that we've not been able to use since we opened December 5th because of this pandemic, because we've had to shift those surgical team members and others to the bedside to care for patients who have COVID and other conditions. It will take a very long period of time. It will take months to work through this backlog of surgical patients that we have in our region. It will also, the thing that concerns us too is, a lot of people have those high deductible plans, and in the year previous, in 2020, before 2021, they missed that opportunity to hit that deductible before the first of the year when that rolled over again. And here again in 21 to 22, they've missed that window of opportunity as well. And so they're starting with that deductible cost again, out of pocket for their surgery. So the implications of this surge and of this virus and of what we're dealing with goes way beyond just caring for our patients and the overburden of our staff. It affects many things down the road, and the ability to provide necessary and highly needed services such as surgical services to our patients is one of those.
And one more from Boris for you, Brian. If Omicron, as expected, causes many more infections but a lower share of hospitalizations, how will that affect IU Health Bloomington, particularly given that the hospital is essentially full and that hospital staff also may be required to isolate and quarantine? What share of hospital staff at IU Health Bloomington is currently unavailable due to isolation and quarantine?
Yeah, so we are seeing a high number of team members who are having to quarantine because they have tested positive or have symptoms. At any given time, we have hit this past week, we've hit over 100 team members, 100 team members who have been quarantined or symptomatic. Those continue to roll as well, but that's the highest number. Now that we're over 100, that's the highest numbers we've seen since this pandemic began. That's endemic of this Omicron variant and how quickly it spreads from person to person. And I will say that, there's not enough data at this point to really say, is the hospitalizations at the same rate that we've seen? While there's some data out of South Africa and the UK, their situations are different, their vaccination rates are different, so we really can't say for sure. But I can tell you that our hospitalization rate has not declined. And it's actually in the middle of this surge when the State Department of Health is reporting that about 50% of the variant a week ago was Omicron here in the state of Indiana, and our admissions continue to increase. The other thing I'll say is just, from layman's brain and anecdotally here, this Omicron infects a lot of people, and the doubling rate is so fast that even though Delta, we may see on the beginning data that Delta is creating more hospitalizations in the beginning than the other variants, the numbers of people who are spreading Omicron is hitting a high number of people and spreading fast to those immunocompromised patients. And they are, what we can see in the initial stages here, are getting hospitalized. So we really don't know the answer to that question, but our hospitalizations are not declining. So we tend to think that that while the rate of hospitalization with Omicron may or may not, it may be at a lower rate, the spread of Omicron and the numbers, as Penny Caudill said, of people in Indiana who have this virus is going to create hospitalizations potentially at the same rate that we're seeing with as far as numbers, maybe not percentage of the variant, but at the same number of hospitalizations is what we're seeing.
Question from Dave Askins for Mayor Hamilton. Are the city's collective bargaining and negotiations with the police union proceeding independently of the COVID-connected lawsuit filed this week?
We did have lawsuits filed, a lawsuit filed by 3 unions contesting our OSHA-related and actually independent from OSHA-related safety requirements. We'll proceed with those. They do not affect the police quadrennial collective bargaining negotiations. So.
Another question from Boris Ladwig. This again will go back to you, Brian. What share of cases at IU Health Bloomington is being sequenced for variants, and what's the process? What does IU Health decide which ones get sequenced, and what are the criteria for that?
Yeah, we do not sequence all of the results go to the Indiana State Department of Health. They make all of those decisions. They have the algorithm by which they determine which ones get tested for which variants and do the reporting. So I would direct you to the Indiana State Department of Health website, where they demonstrate the percentage of cases on the daily and weekly basis and what variant they are being tested for.
Question from Dave Askins for Mayor Hamilton. And Dave, by the way, I think one question got posted twice here, so make sure I'm not skipping something. From the OSHA compliance policy seems to be set up to be more accommodating for those who choose to be vaccinated. For example, paid time off available for vaccination, even for employees who don't have paid time off coming. In contrast, employees who choose the testing option have to schedule their tests outside of working hours. The question is, frequent and easy testing is supposed to help prevent the spread of the virus. How do you respond to the criticism that the city is making testing as onerous as possible in an attempt to persuade workers to get vaccinated? Why doesn't the city just set up testing availability in the workplace?
Well, thanks for the question. I'll just make a couple points, I guess. One, we agree. I mean, I think everybody would like to have more testing available. That's a really important issue for all of us since the start of the pandemic. And I know the federal government's working on that. Everybody here on the call, and we all try to encourage and do the ways we can to get more testing available. It is really important. I think the second point I'd make is we strongly encourage vaccination. I think that's the way I would put it. We don't discourage testing in any way, but we do strongly encourage among our workforce, as we can directly, encourage vaccination. That's what keeps our workers safe. It keeps our workplace safe. It keeps our community safe. We just heard hundreds of our fellow community residents are in pain because they cannot get procedures that they should be getting at a hospital. And we want to do everything we can to diminish that, which means do as much as possible to encourage folks to get vaccinated and boosted. So we will continue to do that in our ways as an employer and as a partner with others. But I would put it that we encourage vaccination. I agree that we want as much testing availability as we can, and I know there are a lot of people working to make that increase possible.
Next question, Boris Ladwig from the HT puts out to anyone. I'm going to direct it to Aaron. The share of vaccinated and boosted people who are getting infected appears to be increasing, which is causing some people to say vaccines are useless. What's your message to people who are still confused about whether a lower risk of infection, spread, severe illness, and death is better than a higher risk?
So I would take that two ways. First of all, we should understand that as more and more people get vaccinated, the percentage of cases that are amongst vaccinated people go up. It's my hope that someday 100% of cases we see are amongst vaccinated people because 100% of people will be vaccinated. So that metric alone is not useful technically. But the other is that it's important to remember that the purpose of vaccines was not first and foremost to prevent cases. It was to prevent bad outcomes from cases like hospitalizations and death. And they have worked spectacularly so through every single variant in providing that benefit. Every week we get on these press conferences and we talk about how the hospitals are stressed almost entirely with unvaccinated people. Yes, some breakthrough cases do occur, but being vaccinated massively protects you against those bad outcomes. If we shift this illness through vaccination to one where people get it, but nobody gets very ill, that's a massive win. And so we will see with Omicron, it's very infectious, but the vaccines still really, really protect against hospitalization and death and other bad outcomes. And that's the true metric on which we should measure it. So yes, my almost 18-year-old boosted son got COVID over winter break, but had a stuffed nose for like 2 days. And none of the rest of our household got it. That's a win across the board. It's not a loss that he got COVID, even though he was boosted. It's an amazing benefit that no one got very ill and people were still protected. And I think it's important that we keep our eye on the ball there.
Okay. And a question I'll direct to Kathy Hewitt. Will there be a decision made at any point soon to institute the newly reduced CDC recommendations for quarantine times for local schools, including students and staff?
School recommendations are set by the local school boards. I know that school officials and boards are looking at the new guidelines and are reviewing and determining what they want to put in place for the schools. So I expect that there will be changes soon, but I don't know quite when they'll put those in place.
Okay. All right. Well, we are just after 2 o'clock. We are at time. We are scheduled to be back again next Friday at 1:15. So we will plan to see you then for our next update. Thanks, everybody.
Thank you all.
Stay
Be
safe.
well.